Your hand is resting on a hot stove. The skin is burning, but your brain receives no pain, so you do not pull away. That sounds like a superpower for about 3 seconds. Then you smell smoke and discover that the damage happened anyway. Now imagine the same silence everywhere. No toothache, no sprained ankle, no warning from a cut, and no pain from inflammation. This is not the same as being brave. You are not ignoring pain. The emergency message itself never reaches you. Normally, specialized nerve endings called nociceptors patrol your skin, muscles, joints, and internal organs for potentially damaging events. Extreme heat, crushing pressure, or chemicals released by injured tissue can activate these sensors and start an electrical signal. The signal travels through peripheral nerves, enters the spinal cord, and reaches brain networks that locate the danger and make it feel unpleasant. That unpleasant feeling changes your behavior. You release the pan, protect the ankle, stop chewing on a sore tooth, and rest an injured joint. Pain is therefore both an alarm and an instruction. Something is wrong. Stop what you are doing and investigate. If that alarm vanished tonight, the first day might feel wonderfully easy. A headache could disappear. A blister might not bother you. But the cause of each problem would remain. The blister still tears. The tooth still decays. The strained muscle is still damaged. By lunchtime, tiny injuries would begin collecting. A sharp object in your shoe could cut your foot with every step. You might feel pressure or touch, depending on the cause, yet never receive the urgent signal that tells you the pressure is causing harm. That evening, you could keep walking on a fractured toe because nothing forces you to stop. Each step can worsen the injury. Over weeks, repeated stress can damage joints. Without pain limiting movement, bones and surrounding tissue may gradually deform. This resembles the serious joint destruction seen in some people with congenital insensitivity to pain, a group of extremely rare genetic disorders. These conditions are present from birth. They show us what a genuinely pain-free nervous system is like, not what pain medicine normally does. One well-studied form involves the SCN9A gene. It provides instructions for a sodium channel in pain-sensing neurons called NAV1.7. Think of NAV1.7 as part of an electrical gate. When the gate cannot work, many nociceptors struggle to send their warning signal onward. The person can still be awake, think normally, and often feel ordinary touch. What is missing is the painful meaning of damaging stimulation. Some people with SCN9A-related pain insensitivity also cannot smell because NAV1.7 helps certain smell-sensing neurons transmit signals too. Other genetic forms work differently. NTRK1-related CIPA can affect pain and temperature sensation and also reduce or eliminate sweating. No sweating creates a second danger. In hot conditions, the body may struggle to release heat, allowing temperature to rise dangerously. So, never feeling pain is not one identical condition. The exact missing sensations and additional risks depend on the biological cause. Yet the daily problem is consistent. Injuries do not announce themselves. A safe life requires replacing pain with deliberate inspection. Every morning, you would check your feet, hands, mouth, and skin for swelling, cuts, burns, bruises, or signs of infection. Shoes would need careful inspection. A small stone, rough seam, or folded sock could quietly injure the same spot for hours. You would watch your joints for warmth or swelling and treat an unexplained limp as evidence, even when nothing hurts. Your eyes would need protection too. A scratched cornea may go unnoticed, and repeated injury or infection can threaten vision. Food and drinks would be tested by temperature, not courage. Hot showers, cold exposure, and high-impact sports could carry extra risk. Doctors and dentists would rely less on where does it hurt, and more on examination, imaging, body temperature, and the visible changes. Internal illness could also become harder to recognize in some forms. Pain that normally directs attention to the abdomen or chest may be absent. That does not mean every pain-free person experiences every complication. These disorders vary, and careful medical support can prevent many injuries. There is another important distinction. Protective acute pain is different from chronic pain, where the alarm may continue after its useful job is over. Researchers study NAV1.7 because selectively reducing harmful pain without disabling every protective warning could lead to better treatments. But copying a lifelong genetic absence with a temporary drug has proved difficult. Blocking one channel has not always reproduced complete pain relief. The nervous system adapts across development, and pain involves several interacting pathways. There is no simple universal off switch. So what if you could never feel pain again? Life would not become fearless. It would become a non-stop investigation. You would trade an automatic alarm for mirrors, thermometers, daily checks, medical scans, and strict rules about heat, pressure, and impact. Pain can be exhausting and sometimes cruel, but when it works properly, it is your body interrupting you before silent damage becomes permanent. The real superpower is not feeling nothing. It is receiving the warning, understanding it, and knowing when that alarm itself needs treatment.